If you're watching this video, you're likely a candidate for bariatric surgery at the Centre Hospitalier Universitaire de Sherbrooke. The purpose of this video is to describe bariatric surgeries and their related complications, and answer the most common questions on bariatric surgery. If you have other questions or concerns after viewing this video, please discuss them with your nurse or physician. The complications of obesity. Your presence here today means that you've decided to seek other ways to help you lose weight and try to solve your problem with obesity and the health issues resulting from it. Obesity is defined as excess body fat that may impair health. It is measured in terms of body mass index, or BMI. Body mass index is calculated from a person's height and weight and is normally between 20 and 25. The BMI also helps determine the type of obesity. Obesity is defined as having a BMI equal to or greater than 30. Severe obesity is defined as having a BMI equal to or greater than 40. People suffering from severe obesity, a BMI equal to or greater than 40, or whose weight is about 45 kilograms or 100 pounds over their healthy weight, may be candidates for obesity surgery, also referred to as bariatric surgery. Several health issues or complications are the result of obesity, including diabetes, high blood pressure, heart disease, sleep apnea, gastric reflux, infertility, various joint disorders, and hepatic steatosis, or fatty liver, that can lead to cirrhosis. Certain cancers are also associated with obesity. Patients who suffer from obesity may also experience various mobility-related problems and difficulties accessing certain areas. Bariatric surgery. The goal of bariatric surgery is to help patients with severe obesity lose their excess weight. This weight loss helps, among other things, reduce or avoid complications caused by obesity, and improve patients' quality of life. You'll be able to establish how you could potentially benefit from bariatric surgery by discussing it with your physician. The different bariatric surgeries. 3 types of bariatric surgeries are frequently used to treat obesity: adjustable gastric band, gastric bypass, and biliopancreatic derivation. In certain cases, the surgeon may suggest other types of procedures. Some complications are common to all bariatric surgeries, while others are specific to one or the other of these surgeries. Common complications include conversion to open surgery, wound infections, bleeding requiring transfusions, thrombophlebitis, or a hospital-acquired infection. These complications are usually diagnosed within the first month after surgery. The risk of mortality is about 1% and can occur following a heart attack, pneumonia, or pulmonary embolism, or a leakage of gastric fluid with peritonitis. Some patients will not experience significant weight loss or will gain weight following their procedure. This normally happens when patients revert to poor lifestyle habits following surgery. Normal digestion. The digestive system is comprised of several organs that transform and absorb food. Food travels from the mouth towards the large intestines. Normal digestion follows this route. Food is first chewed in the mouth and then passes through the esophagus to reach the stomach. The stomach acts like a reservoir where enzymes and gastric contractions come together to transform food into semi-liquid matter. The transformed food makes its way to the small intestine. The main function of the small intestine or small bowel is to absorb food. This absorption mainly occurs at the beginning of the small intestine, in the duodenum. Lastly, the large intestine, or colon, transforms the liquid residue into solid waste, or feces. Bariatric surgeries have an impact on normal digestion by reducing the size of the stomach or shortening the length of the small intestine, which reduces the absorption of food. Satiation, or the feeling of fullness or satisfaction, is transmitted by nerve impulses activated when the stomach is stretched from food. This message takes 20 minutes to reach the brain, regardless of the size of the stomach, with or without surgery. It will be very important to eat slowly to reach satiation without overeating following your surgery. The mechanisms involved in weight loss following bariatric surgery. The mechanisms involved in weight loss following bariatric surgery are restriction and malabsorption. Restrictive surgery limits food intake by reducing the size of the stomach. Malabsorptive surgery limits the absorption of food by shortening the path food can take through the small intestine. Treating obesity involves several components. Lifestyle changes in terms of dietary changes and adapted physical exercise form the basis of treatment. These changes must also be maintained by patients who have had surgery. In some cases, patients may also be prescribed medication to stimulate weight loss. The different procedures used to treat obesity result in different amounts of weight loss that are proportional to their level of risk.